Okay, come on in. I'm Sean, nurse practitioner. You can have a seat facing away, if you don't mind. Today we're going to be doing an advanced upper respiratory examination. So I'm just going to rotate you this way so you can see your back. First thing, we're going to just have the female in a sports bra so we can visualize the anterior posterior aspects of the chest. And we're going to be looking for any signs of respiratory distress. An older child or adult, that would be tachypnea, use of accessory muscles when breathing, maybe a I to E ratio greater than 1 to 2, for example, prolonged expiration, or maybe even cyanosis. In infants, you'll see the nasal flaring or grunting. Okay? Since we're back here, we'll start with the posterior inspection, looking for any scars, lesions, deformities, looking at the spinal alignment, any spinal deviation, may be indicative of scoliosis, not the case here. Okay, so go ahead and face us, Megan. Good, looking at the anterior aspects for any scars, lesions, deformities, looking, here at the sternum, if that sternum was indented, it would be a funnel chest, or maybe perhaps the sternum was protruded, it would be a pigeon's chest. Okay. Also looking at the anterior to posterior to transverse ratio, nice 1 to 2 ratio is good. Any greater anterior to posterior distance, would be that 1 to 1 ratio, such as a barrel-chested patient with COPD. Okay, good. So now we're going to go ahead and jump right into palpation. So yeah, good. Just like so. See if we can get this on camera. So we're going to go ahead and start with just assessing lower back. Okay, so go ahead and take a big inhale and exhale. Good, one more time. And one more time. Good. Good. So looking at those thumbs, seeing them move away equally and symmetrically with inspiration and expiration. If one didn't move as much as the other, we're thinking a deflated lung with that asymmetrical movement. Okay. Now we're going to do tactile fremitus. So Megan, we're going to have you say 99 in a deep tone repeatedly. 99, 99, 99. And I'm going to feel with the palmar aspects of my hands. See if I can get this on camera. Essentially film the 5 locations as you repeat. Okay, so you can begin when you're ready.
99, 99, 99, 99, 99.
Good. So any diminished or absence fremitus may mean a mass or fluid, and a hyperresonance would be indicative of a hyperinflated lung. Okay, so now we're going to go ahead and have you turn around for me, and we're going to do some percussion. Start up here. Good. 8 locations in the anterior, going in the right side. And left side.
Okay, it's the turn.
Okay. Move line. Just want the camera to pick that up. Good. And turn around for me. Or I'll
Wait, my back.
percuss the back. So that hyperresonance may be indicative of a hyperinflated lung, and maybe a dull, diminished resonance would be indicative of a lung consolidation, mass or fluid. Okay. So now we're going to percuss for diaphragmatic excursion. Essentially going to have Megan, got my pen, tape measure here. All right, we're going to have you inhale and then hold. And I'm going to percuss down the side of your back. So I'm looking just for where that resonance changes to dullness. Okay? Both sides. Okay? So go ahead and inhale and hold. Okay? When you're ready. Okay, breathe. Marking that lower line. And the other side. So catch your breath. Whenever you're ready, we'll restart. Inhale and hold. Okay, breathe. Now we're going to work our way up from the bottom. So go ahead and exhale and hold when you're ready. Good. Breathe. And again, working our way up from the dullness to the resonance when we hear it. Okay? So go ahead and breathe and exhale and hold. Good. So a couple things to note: 3 to 5 centimeters is normal. The right side may be a little higher because of the liver, and sometimes things may, or like a decreased diaphragmatic excursion may be due to the lungs not being able to get enough air, which may be because of emphysema, pain, or even a tumor. So we're just going to go ahead and measure in centimeters, looking at about 4.7 on the left and about 4.5 on the right with some normal limits. Very good. Now we're going to go ahead and auscultate. Oh, excuse me. We're going to move right into auscultation. So Megan, just go ahead and breathe normally in and out through your mouth. I'll start with your back so you don't have to move. Listen to all 10 locations. Very good. Yeah, and just, to note, listening for if we were to hear any crackles, rhonchi, wheezing, or even friction rub may mean pneumonia or a lung disease. So this is the left side, just normal breathing in and out through your mouth. Good. And then I'm going to do the right side if you don't mind, so don't forget about it. Perfect. Thank you. Good. And then we're going to do the anterior aspect. So you can just face forward to our 8 locations. Excuse me. Sorry about that. Good. So now we're going to have you go ahead and face away from us so we can see your back. And we're going to auscultate, and this is called egophony. essentially going to have you say the letter E for a prolonged amount of time, E, and I'm just listening for any change in that, maybe to a from an E to an ah, may indicate a lung consolidation. So we're also listen to all 10 locations when you're ready. E, 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 Very good. Okay. Next one is the whispered pectorally. Essentially, you're going to have you whisper 1, 2, 3. So 1, 2, 3, 1, 2, 3. And this should be an indistinct sound, but if it is increased loudness, we're thinking consolidation. Okay, good. And now we're going to do the bronchophony. Essentially, have you say 99 normally. You don't have to whisper, not in a deep tone. Just say 99, 99, and I'm going to take a listen. And again, this should also be a relatively indistinct, quiet sound. Any increase in sound, lung consolidation. Okay.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Very good. Okay, thank you, Megan. And that concludes our upper respiratory examination.